Okay, well, good morning, everyone. Thanks for joining us on this Friday. Unfortunately, it's a little rainy out today, but it is Friday. Weekend is coming. This is day 48, or call 48, of our daily series. It's hard to believe it's been that long we've been doing this. And I do want to note before we jump in, a housekeeping item for those of you who were on the call yesterday, maybe weren't on the call yesterday. We are moving starting next week to a Tuesday, Thursday format. So based on the fact that many people are returning to work, getting back in the swing of things, we felt it was time to transition ourselves to that. So we wanted to make sure we maintained some structure. We're still going to be here on a regular basis, but just not as frequent. So hopefully that will work better in everybody's schedule. Tuesday, Thursday, 9 o'clock, same time. We're still going to bring on speakers. In fact, next Tuesday we have a special speaker, Carrie Rathbun-Hawks. Many of you know Rathbun Public Relations. She's going to come on to talk about communication. So I think it's an excellent topic on the heels hearing from Larry today that, companies and businesses not only need to implement appropriate protocols, but they need to communicate that effectively to their customers and to their employees, and that's what Carrie does. She helps with the PR communication aspect. So she's going to be on Tuesday morning. But I want to make sure everybody's aware. So if you try to call in on Monday, there won't be a call. But as I said, hopefully 2 times a week we'll still give you good information. And also, as you know, anytime you need anything in between those calls, you're always very welcome to get a hold of us. We're here to help. So with that, I'd like to jump into today's program. Very grateful to have our friend Larry Johnson from the County Health Department. Larry was on, probably about a month ago to give an update on where things stood in Shiawassee County and also some considerations that businesses may want to look at as they work to reopen. We've had a little bit of a spike in, not the virus, but a spike in communications from businesses in the last few days, saying, hey, we're really starting to look to reopen, particularly retail businesses now that they're able to bring in people by appointment. And so I've had several requests from companies just to get a refresher on things that they need to consider as they work to reopen to be safe for the public. So I thought it was a great time to have Larry come back on and give you an update and give you some of those ideas to help you reopen your business. So with that, I'm going to turn it over to Larry Johnson, who's doing an awesome job for us protecting our public health here in Shiawassee County. So Larry, the floor is yours.
Thank you, Justin. Can you hear me?
Yep, you're all good. Yep, go ahead.
Okay, excellent. Thank you so much, and thank you for the kind words. I haven't always gotten those the last month or so. But anyway, thank you for having me here today, everyone. I just wanted to give you a brief update. I know as we're transitioning now to reopening, there's more and more questions than probably answers right now, but we'll start with an overview of cases in the county. And what we're seeing is a positive trend. Our curve is flattening, both in the county and at the state level. Our 14-day case average has been pretty level. We've continued to see positive cases, but not at the exponential growth that we saw early on. So we have 241 confirmed cases. We have 26 deaths. 19 of those deaths were related to nursing homes, long-term care facility residents. So it has really, really been tough on the nursing homes. We are one of the counties that has really done a lot of testing in our nursing homes, which is also why our numbers are somewhat higher for our population. And of almost 40% of our cases have been nursing home related. So we're continuing to monitor that, and that issue is catching on statewide now as the National Guard is conducting testing in nursing homes, and after this call, I got to jump on a call with them. But anyway, more positive news. We have 176 that we've declared recovered. These are individuals that we were monitoring under quarantine isolation. And so what we've seen recently is more recoveries than we have new cases. So that's allowing us to move forward with the safe reopen, both in the state and here in the county. State level, Michigan's been one of the harder hit states, 56,014 cases, 5,372 deaths. I do get a lot of questions on how a COVID death gets counted. And, there's been controversy that people saying, well, we're just counting everything as a COVID death. Well, the attending physicians and the medical doctors sign the death certificates for individuals. And obviously many of these people have had other conditions. So if they are diagnosed with COVID and they do pass, it is counted as a COVID death. Now, if they had cancer or they were terminal, they had other issues, that's still listed on the death certificate, but it's still counted as a COVID death. Now, if they were terminal and the individual was probably going to pass anyway, what you're seeing with COVID is that it accelerates it. So maybe they would have lived 6 months or a year or 2 months, and COVID hits them with those other conditions and they're dead in less than a week. So I wanted to clarify that because that definition is also set by the federal government. It's set by the CDC. So I get a lot of pushback on that, and I just don't have anything to control over it, but it is an accurate number. So moving on, I've said we've seen the positive signs, more recoveries. Many of you are probably familiar with the governor's My Safe Start plan. She released this week the map that shows what phases we're in. It's a 6-phase plan, and the Shiawassee County is in phase 3, which is basically case growth is gradually declining. More and more businesses are starting to open: construction, manufacturing, retail, outdoor work. And then the governor has taken some further steps to open individual retail by appointment. She's going slowly. And for some it seems too slow, but she is being cautious. Now in the Upper Peninsula and the Northern Lower Peninsula, they're in phase 4, okay, which is case hospitalizations and deaths are clearly declining. They have opened more businesses up there, including restaurants, which are at 50% capacity. So one of the things I would see here is when we do get to the opening of the restaurants, we're probably going to see reduced capacity, at least to start in those restaurants. And so that's basically a mechanism to ensure that we can get some social distancing and keep the separation and make the patrons feel comfortable. So locally, our hospital capacity is good right now. We're continuing to move forward with developing plans for the reopen. And here at the county, we are open by appointment. And then on June 15th, barring no extensions of the executive order, we would be open to the public. So what we're doing is, and what we're required to do is develop a plan. Businesses need to develop a plan for reopening, and that's in the executive order. And I don't know if Justin's talked to you or if you're going to talk more about that. But basically, I provided a framework or a guideline about a month ago on how to develop a reopening plan. And one of the requirements is that your employees are trained on safe reopening and safe procedures. Now, this training is pretty general. I mean, what we're using at the county is a series of minute or two YouTube videos covering hand washing, covering social distancing, covering the proper wearing of PPE. And what we're going to do is have basically a sign sheet that the employee had reviewed that. They looked at a PowerPoint that we've put together and that they've taken those steps to be aware. Now, most people know this stuff, it's basics, but we are in a very litigious society. I have a feeling there's going to be a lot of lawsuits coming out of COVID. And one of the things I do know, and what I'm going to encourage all of you to do, is check with your insurance agents and for your liability insurance, because what we're finding is COVID's not covered. So whether it's a church or a business, you want to touch base with them. You want to do all the steps to make sure that you're covered. That yes, my employees signed this sheet here and they were trained on the proper use of PPE. Because if there is a COVID case that they can trace back, or God forbid a death, it's a liability concern. And really, it's probably the premier reason why you saw the Shiawassee County Fair, which is unprecedented, took the action by a 20-2 vote to shut the fair down this year, and it was mainly liability. Now they did consult with me, and contrary to what some people believe, I didn't shut down the fair, but I did advise that this year was going to be challenging, and so I thought they took the wise move. You've seen most of these other large outdoor gatherings cancel, but liability is a big concern, so I can't stress that enough. So just circling back, we are improving. You're going to continue to see more and more businesses open. Our governor has acted very, very stringently, whether you're for that or against that. Those are the facts. She has done that. Our case numbers compared to the rest of the country are really good in terms of our decline. You could argue that the steps were severe, but we're on the right trend. We're on the right track. We're going in the right direction. And we don't want to see that second curve come back, that second wave. And as far as the vaccine right now, I want to touch base on that real quick. Lots of positive action. Many vaccines are in human trials right now, all around the world. There's hope by the end of the year, going into the early part of next year, that something might be delivered. I know that would be historic pace, rapid pace to get it that fast. But I'll be honest with you, there's people that are just not going to want to be comfortable until they have that needle in their arm, basically. So we want to make sure that those are safe. The early trials and the early results that we're seeing in some of the human trials are real positive. So it could happen. We've got I think the president calls it a moonshot to try to get that vaccine developed faster than ever before. And so today I'm bringing you some good news. I do not have a lot of answers to some of the questions. I know Justin fired some questions at me this week. I'll try to take them as I can, and if I can't get an answer, I'll try to look up the answer for you. Casey Elliott, my point person over in environmental health, is my point person on working on these issues for what can and what can't open. I can tell you right now, one of the biggest questions we've been getting is campgrounds. People want to get back to the campgrounds. I'm very hopeful that the governor takes action on campgrounds. I think that those can be handled in a safe way. Right now, if you have a second home type campground, those are allowed to be open, but the regular camping camp ones aren't, and people are having a hard time with that. So I've transitioned to getting yelled at for golf courses and landscaping to campgrounds. So we're hopeful that something comes real soon on the campgrounds. I suspect it will. And so anyway, I'm going to turn it back over to Justin. I gave you guys a brief overview here, and I'll try to, when we get to the questions, I'll try to take whatever you ask, and if I can't answer it, I'll try to get an answer. So Justin, I'm going to mute myself.
All right, perfect. Thanks, Larry. Once again, you're doing an awesome job for us. I do have, and this is a question to you, I do have a copy of those business considerations that we did send out to the group several weeks ago. Is that still current, and can I send that out again?
Yes, that's current. That thing that I sent you a few weeks ago was a nice, a lot of infographics that you can use and copy. Now it's getting to more taking that document I gave you and kind of putting it into a Microsoft Word format. Okay, I'm doing this step, this step, this step. And so I've got what I've got here at the county. I could probably share that with you, but you're probably going to want to adapt something more business related. And this doesn't have to be like, this isn't rocket science here, hand washing and social distancing. So I think we can put something together. You can copy it. You can just put, why reinvent the wheel? That's one of the things we've learned. So I'll share whatever I have with you guys.
Perfect. And if people have, like, once again, you don't have all the answers, but if individual businesses have specific questions, am I doing this right, am I not, they could call Casey, is that correct?
Absolutely, yeah. He's our point person over there. I'm going to give his number right now. Area code 989-743-2289. Casey Elliott, 743-2289. He is the Director of Environmental Health. He's very knowledgeable on the executive orders and all the businesses. He's been working on it since we started.
Perfect. And I will send that name and number out via email to our contact. So hopefully we won't bombard them too much. Any comments or questions from any of the listeners today? If you do, please hit *6 on your phone.
Hey, Justin?
Yeah, Rich, go ahead.
Yeah. In regards to health of people that could be affected by COVID in the future, one of the issues can be breathing, and where face masks are being required, that can impede breathing. It's my understanding that the face mask, if it impedes breathing, like somebody has asthma, that they're not necessarily required due to that condition on a state level. Am I reading that right?
Yes, let me respond to that, Justin. You are absolutely reading that right. I'm sorry I forgot to cover that point. The executive order requires face masks in public indoor facilities. But if you have a medical contraindication such as asthma or something that could limit your breathing, then you are not required to wear a mask. Now you may get asked that question, but you are not required to wear a mask if you have a medical condition. And you will probably see around the community, depending on the facility you're in, that's not been strongly enforced. There's quite a few people that are going out without masks, but there are also people that are wearing masks. So for you, for all of you, I would recommend protecting yourself. And here at the county, we're going to be requiring people to come in to our facilities. They got to wear masks. Now, we're also reasonable and practical. Like for instance, in office space where you're separated, sitting at your desk right here where I'm at right now. I'm not near people. You don't need a mask while you're sitting there. But if you're interacting with public in the public areas, then the mask is required if you don't have the medical contraindication. Good question, though.
Can I follow that up, please?
Yeah,
go ahead, Rick.
Okay. The issues that you can have with that kind of thing, especially when we're talking in a factory atmosphere, is that you have substantial heat during the summer, and if you have welding going on or different things like that, so should that be spelled out as far as you make it on the individual to say, hey, I have a breathing issue, I can't wear the mask? Should all that be spelled out as far as policies and procedures to take the liability away, hopefully?
Yes, absolutely. The more that you can spell out, the more covered you are. As I said, going back to the liability insurance, and you make a very good point. There are situations where you're going to have potentially very hot conditions. It's hard to breathe. If you got glasses, they fog up. So nothing's going to be perfect here. So you guys got to use your best judgment. Cover yourself with the training and the policies and procedures in place on how to do it. And do the best you can. Like I tell people a lot, there's no playbook for this, so we're working our way through it. And if you have questions specific to that, we can kind of work with you on the side to help you develop something or give you some guidance on that.
Larry?
Yeah.
I'll try to get in touch with you later today. I'm involved with Rivers Fab and Welding and Rivers Security Specialist here in Owasso. I also am a business consultant, so there's a lot of things that, with your viewpoints, I'd like to find out more. So.
Sure, absolutely. Yep.
Thank you. Thank you, Justin.
Thanks, Rick. Yep. Other comments or questions from anybody? Hit *6 on your phone, please.
Hi, this is Quick question. Go ahead.
I heard Randy and Colleen. Who wants to go first?
Go ahead, Colleen.
I'll go first. I just had a quick question. Have you noticed a rise in respiratory infections because of people wearing the masks? When everybody first started wearing them, I'm sure they were all new. But now that people have been wearing them a while, should we be putting out recommendations for how to clean them?
Yeah, that's another good question. You guys are doing good today. So the homemade masks that people are wearing can be laundered. The surgical masks, depending on your exposure to other people, can just be pitched and wear a new one. If you're in an office by yourself and you got a surgical mask, it can last a while. But if you're going to Meijer and you're dealing with the front desk, then you're gonna wanna replace that. We're not recommending the N95s because we need to save those for the first responders, frontline workers, and we're still having some shortages on that. And there is some guidance out there on sanitizing masks, but laundering them if they're cloth, and I see a lot of cloth masks out there, is sufficient. But that's an excellent question.
Okay, Larry, Randy. My question's a little simpler. I just want to reiterate the information you're going to provide that you folks are doing. Will that include the links to the YouTube videos, the training videos and stuff that you're using?
Yes, absolutely. I can share that today. I'll get it to Justin.
Okay, that's kind of hard to find. Something just specific for that kind of training, and that would be very helpful.
Yeah, no problem.
Thank you very much.
Thanks, Randy. Other comments or questions for Larry? It's *6.
Hi, my name is Jasmine. I'm calling with Mid-Michigan now. I do have a question for you, Larry. Can you hear me?
Yes, I can. How are you?
I am doing well. I hope you are also. I just wanted to know, in regards to the number of cases, have you seen any evidence that there has been an uptick or not in relation to Carl Manke's barber shop being open?
Excellent question. One that I've received 3 times already today. So to answer your question, no. We have not seen an uptick in our local cases because of anything related to protests over there at the barber shop. Now, I would put a caveat on that many of the individuals that have been over there at the protests are not from our county, and we wouldn't necessarily know and may not ever know if they have an exposure because they're going to be counted in their home county's numbers or their home state if they were from out of state. And so unless we're able to find something through contact tracing and someone communicated that to our health department, we wouldn't necessarily know. So as far as our case numbers, they're still relatively stable. We have not had any direct link to that barber shop. And but I will say some of our new cases, the positives we've had aren't necessarily nursing home individuals. So we are still seeing some community spread out there. But so we want to continue to be safe.
Awesome. Thank you.
Thank you for your question. Okay, other comments or questions for Larry? *6 on your phone.
Larry, this is Mark from Daystar. Can you hear me?
Hi, Mark. How are you?
So, by the way, I think you're doing just a great job. The website has all kinds of information, and I hope that all over the nation, I hope that public health gets its due. And if you got your due, you get such a huge increase in budget. I'm not holding my breath, but I hope that happens. So what is the business's responsibility if an individual becomes just sick? Let's say they're not tested with COVID. They say, I got a cough or whatever, and they get sick. We say, go home. But for the other people that work with them, do we just alert them that this person is going home sick and then go on from there? Let's say that individual finally gets COVID. What do we as a business have to do with our coworkers?
really good question, Mark. And thank you for the kind comments, too. I appreciate that. So general illness would be no different than how most businesses normally handle it. If they're not feeling well, send them home. And that is heightened now. So if they're not feeling well and they've got symptoms, send them home. And if they have COVID symptoms, you're going to want to strongly recommend they go get tested. And they can do so at Memorial Healthcare. Memorial's got the testing site. If they are found to have COVID, if it's COVID positive, you don't name them to their coworkers, although it's pretty usually easy to figure out. But you have to look at the exposure to their coworkers. Were they working side by side? Were they working in the same cube? Were they working in the same office? Were they 2 floors away? And might have touched some doorknobs. The public health, our nurses will work through who you would need to exclude from work versus who could continue to be there. And so if they were excluded, then they would be quarantined. Quarantine means you're not sick, but you have exposure. You got to be out of work. I think you got to be 10 days symptom free, 3 days no fever before you can come back. If they have COVID and they're tested positive, then obviously they're going to be isolated. And that means they're sick and they need to be home and they need to recover if they're well enough to be at home. And then they can't come back until we release them going through the process to make sure that they can't spread it. So we would have to handle those, obviously on a case-by-case basis. But it would all go through our nurses, through our contact tracing and our monitoring, which we've got a lot of that going on. And it wouldn't necessarily mean that everybody had to be excluded from work, but that's why your businesses are developing plans to try to socially distance people at work and try to keep people as separate as possible. And then the other thing that I got to talk about too is cleaning. If that were the case, you got to look at what your cleaning mechanisms are for your facilities. Are you increasing cleaning? In a case of a COVID positive, you're going to want to really give her a deep clean. So make sure you're checking, like I said, liability insurance and check on your cleaning. But great question, Mark. And like I said, we would work with you any business on a case by case.
Can I ask you one more question about a nonprofit?
Yeah, go ahead, Mark.
So if you're part of a church and someone tests positive for COVID, what is the church's responsibility to the health department? And could the health department suggest or say, hey, you had this person that was tested positive, you need to not meet together?
Woo, you got me with some good ones here today. So the church is a sensitive issue, the separation of church and state. Churches right now can meet with no punishment. There can be no fines or any enforcement action on them. Many, if not all, churches have taken extraordinary steps to protect themselves. Many have still not gone back to meeting in person. I know because I'm working with my church on this issue right now. The health department would obviously contact any known exposures. We would contact the church. We wouldn't close the church, but I think the church isn't going to want to be the site of a outbreak, if you will. So churches, and I know this from our experience, we're checking with our legal right now and our liability insurance, and we're also setting up methods to increase the number of services, sign up for services, separate, take all those steps just so you're covered. But no, we're not going to shut down the church.
Thank you very much.
Okay. Larry, this is Diane from DeMar. And
hi, Diane.
Lots of questions that I know are not going to be on this call because it's unique to my business. I'm on a lot of venue sites across the country, and a lot of the questions coming up that I think would pertain to other people is the buffet situation. Are buffets going to be allowed in the near future, or as I'm planning to reopen, do I need to look at doing just plated meals? And how does that affect other restaurants also that do buffets?
Yeah. The buffet issue that's a good question because we've got buffets obviously in the county. We're working with MDART, and you're aware of MDART for guidance on that right now. So I'm hesitant to try to even wing that answer, but that's one I'll talk to you off on the side. Casey and I will, and Christina, who you know real well, will work with you on that for the buffets.
Mm-hmm. And of course, trying to tell brides that I don't know the answer right now of when they can have their wedding. And I know you don't have that answer for me right now. But the other thing is what I'm hearing is the tracking of people. As people come into your establishment, taking name, phone numbers, emails in case there is an outbreak and they trace it back to your location, that they can call and contact the people that are there. Is that something that is going to come into place or not?
Yeah, that's another one I don't know the answer to yet, because the way we've done it in the past for foodborne illness outbreaks is if we had one that got to us, then sometimes we had to track through receipts to try to get to people. I can't answer that right now. I think we should take the food ones on the side for working with environmental health.
Okay, sounds good. And I've been working with Christina too. So, okay, thank you, Larry.
Yep, thanks, Dan.
Thanks, Dan. Other comments or questions? Star 6 on your phone if you have them. Well, last call. All right. Well, Larry, you were right up there for most questions we've had on one of these daily calls. So very productive.
Can I ask one more?
Yeah, go ahead.
This is Yvette Collard, and to tag on to Diane's comment or questions, I think if you could share the buffet information with Justin for his site, because I know I have a graduating senior, and we're trying to figure out if we're having, going to celebrate all of his accomplishments or not. So the buffet thing is a big deal for us open house planners that we're hoping when the numbers are allowed that we can still have. So if you could share that more publicly, that'd be great.
Yeah, Yvette, absolutely. I will share that. My heart goes out to the seniors this year, and I know in particular, I know your son through cross country runs with my daughter, and I just feel so bad about those open houses, about the graduations. I'm in constant communication with the superintendents, trying to come up with plans for what they can do. I mean, another big issue is school reopening this fall and how that's going to look. So no, I will definitely share the buffet information out, and as soon as anything comes out on that, so that families can have get-togethers for these celebrate their graduates, I definitely will. And you should be proud of your son too. He did a great job.
Oh, thank you. I appreciate that. And I had one other question not related to open houses, but the testing, about antibody testing. I'm wondering if we were to get that, I think I understand correctly in the reading, but I wanted to verify it, that if you do test that you have the antibody, that doesn't necessarily mean that you still can't give COVID, you still can't be a carrier, or you still can't re-get it. Is that true, or am I reading the wrong?
Yes, you're correct about that. The epidemiology and the science is still evolving on that. We're hopeful that it will be like other viruses, but it's still too soon. There has been some secondary transmissions through people that have technically recovered worldwide. So they're still developing that right now. That is not the end-all, be-all right now. I mean, people can do it to find out if they've had exposure, but it's not something you want to just act as though it's Superman and a super issue, so just be careful with that.
Okay. Thank you. I appreciate all you're doing. You're doing a great job.
Thank you, Yvette. Any other final comments or questions for Larry? Star 6. Okay. Well, Larry, awesome job. Thank you for taking a lot of great questions today. We do want to send out some follow-up information. Larry, you're going to email me some stuff. Is that right?
That is correct.
Okay. Very good. So once I get that information from Larry, I will share that out via email with everybody on the list. Yeah, once again, I can't thank you, not only you, Larry, your whole team, everything you're doing to protect health. We very much appreciate all of that. So thank you for jumping on today. And everybody, look for an email from me with some more information here very shortly. So appreciate it.
Thanks a lot. Thanks a lot, Justin.
Okay. Well, that was very informative. So hopefully you got some good information out of that. And as we talked there, obviously, if you have specific individual questions on your own business, Casey Elliott over there at the Environmental Health will be able to help you with that. So just a couple of other items wanted to highlight. We are going to be setting up a call next week. I do not have a date and time yet, but we're going to be setting up a call regarding that PACE financing. That is the money financing opportunity to be able to do energy efficiency improvements or renewable energy improvements. As soon as I have a date on that, I will definitely let you know. But I talked with several folks already that are very interested in that. We do have an opportunity, and we've talked about this before, for anybody that would like to partner in any capacity with MSU, Michigan State University. They are trying to become more integrated into Shiawassee County. So if you're interested in working with them in any way, research projects, internships, job hirings, all that, please let me know. But I also want to alert you, we've also been talking with our great local college, Baker College, which is doing some great things. They've been doing great things in this community for many years. We want to highlight some of the things that they're doing as well. So more to come on that. I'm going to be talking with some of the Baker leadership next week, and maybe even have them on a call here in the coming weeks to alert you. We're very lucky to have a great training school like Baker right here in Shiawassee County. So more to come on that. I did get notice yesterday, and we might bring them on a future call, but one of our partners, environmental services firm called AKT Peerless. Some of you maybe have heard of them. They actually are now offering building cleaning and disinfecting services. So if you're looking for sort of full building cleaning, just a total top to bottom type thing, more of an industrial type cleaning, I'll say. They are offering that opportunity now to businesses that need that. So I'm going to be sending out an email on that. And probably what we'll do, as we've done before, is we like to highlight providers that we work with that can offer a product or service to help companies. So this looks very interesting, sort of a top to bottom building cleaning. So look for an email on that, and we'll get that out to you. And then, that's pretty much it for today. I do want to, obviously, and it was talked about, highlight, if you do want to get testing, Memorial Healthcare is offering that, both antibody and virus testing. We do have a list of the PPE. I want to mention that too. I'll keep mentioning that. If you need products, if you need services, we have a spreadsheet. Jody has put that together in our office. In fact, with this new company, we now have 17 different businesses that can offer those types of products and services. So we'll get you that information if you'd like that. And then jobs, as always, if anyone's hiring, please let us know. So, in fact, we just booked yesterday. We're going to have a job fair at the end of June, the first one coming out of the crisis. So more to come on that. But anyway, I'll finish by saying that what I said at the start, we are moving to Tuesday, Thursday next week. Don't jump on Monday. I'll send out an email on that probably Sunday night just to remind you. But we will have a guest speaker Tuesday morning, Carrie Rathman Hawks, to talk about communicating how you're working to reopen and keep your workers and your customers safe. So with that, any final comments or questions from anybody? Star 6 if you do. Okay, well, thank you, everybody. Appreciate the collaboration as always. If anything comes up, give us a holler. And have a good weekend. Thanks.